Good morning, Dr. Kunal. Last time we met, you were telling me about a case of bipolar disorder that you saw, and you told me how common it is. You also mentioned that the awareness about this illness is bare minimum. Now that we have the opportunity, let's talk about bipolar disorder today.
Sure, thanks for that opportunity. Bipolar disorder is an illness that has an impact on an individual's mood. All of us um, have a slightly different prevailing mood. So, you may have observed from your experience that some people are generally happier than
Yes.
others, and some people are generally a bit reserved, and some people are generally a bit short tempered. So, emotions are normal, aren't they? Happiness, anger, sadness, anxiety or fearfulness. Having said that, whenever there is a significant shift in an individual's mood, so somebody who's usually reserved suddenly becomes a lot more happy, confident, outgoing, sometimes even aggressive, that might be because of bipolar disorder.
So, doctor, can you please elaborate on this issue so that our viewers are able to understand it in a better way?
So, as the name suggests, bipolar disorder can happen in two different phases, and it's largely an episodic illness, which means that when people are unwell, they experience symptoms, but then when they become well, they go back to being more or less completely normal. There are two different types of episodes that they can experience. The first one, in which the mood is persistently elevated, is known as hypomania or mania. In this, characteristically what happens is that an individual experiences an increase in the amount of their energy levels, their confidence, their concentration, sometimes even their ability to do more things. They might start new ventures, or they might be slightly reckless and aggressive at times. So, this is what happens when your mood becomes slightly increased. The opposite of this is known as depression, in which people feel sad and have poor energy levels, have poor concentration, don't feel like doing anything, and this is known as depression. So, basically in bipolar disorder, individuals can either experience hypomania or mania or depression, both of which are treatable conditions, and when people are treated, they go back to being completely well.
Okay, now that makes me curious to know about the causes. Can you give us an insight into this?
As with most psychiatric conditions, bipolar disorder is caused by a combination of genetic and environmental factors. So, that means is that generally people are born with a predisposition or a tendency to develop this condition later on in life. What might happen is that there might be some environmental factors such as stress, not sleeping very much, excessive alcohol use or substance use, which might trigger a particular episode of bipolar disorder, but that's not to say that that's the reason of it.
Okay. Dr. Kunal, I would like to know what is the right kind of treatment for the people suffering from bipolar disorder?
I think if anybody believes that they have symptoms suggestive of bipolar disorder, then the first thing that they should do is undergo a comprehensive evaluation by mental health professionals such as a psychiatrist. And during that interview, it's likely that the psychiatrist would be able to advise whether this diagnosis applies or not. Um, One of the main stays of treatment in bipolar disorder is psychological treatment or therapy. If you can imagine being somebody whose mood has suddenly changed and they've ended up perhaps doing certain things that they feel embarrassed about, that might seem a bit too reckless now, and they might not have too much insight about their condition. So, because typically in hypomania, people actually experience things like excess energy, excess concentration, improved motivation. They may not view themselves as being unwell. Um, the second big important part of treatment is medication, and understanding which medications might be suitable for different patients at the right dose, where they don't cause any side effects, they don't have any risks, is extremely important, so that patients can take these medicines comfortably and securely, and not feel as if medicines might do some harm. Often in bipolar disorder, patients don't take medicines for the prescribed duration of time, which might lead to further relapses. Um, The final thing that I'd like to mention is that in certain cases of bipolar disorder, given their presentation and the risk that they might present to themselves or to other people, the initial part of treatment may be better served if it is provided in hospital, because hospital is a safe place, and things like medication and mental state can be monitored a lot more closely.
Yes, for sure. Thank you, Dr. Kunal. Thank you for your valuable information.